Since last 5-6 years, we've been using comprehensive genomic profiling on tissue, and we are all aware of the challenges in the tissue.
Waiting for a tissue is always more time consuming. So when we say tissue NGS, solid NGS, it is always a little bit more time consuming. Liquid is solid is a very appropriate phrase for testing.
Now, liquid biopsy is one particular approach where we get a comprehensive profiling done, get to know a more comprehensive picture of the cancer genome, and we can actually look at those subclones or those small changes in cancer which actually lead to progression.
Which helps us to at least have an extra edge of about 16 to 18% as per the data. We get more mutations and we can identify patients who can get the actionable mutations and the drugs accordingly.
And not only is that very informative, we're using that to treat patients, but it is more informative because it can be measured again and again. It's easy, and a debate is now happening whether it's in fact more important than the DNA in the tissue itself.
What we see is when we do a liquid biopsy first, we get a report with the driver mutations very rapidly. In 9 to 10 days, we have a report, and the reports are very reliable. We are catching driver mutations, our percentage of pickup is very high, and we are treating patients with these mutations and getting good responses.
One can decide which patients in stage 2 needs chemotherapy and which we can safely avoid. Now, that is a very interesting thing because in stage 2, we treat many to save a few. And also in stage 3, which patients to give 3 months chemo versus 6 months chemo. Now, these are some interesting questions which I think so MRD can solve.
In practice, it has definitely changed the way we look at and treat patients, getting immediate testing, rapid reports, and starting their driver therapy as required according to the appropriate reports.
So more information is better decisions, and better decisions are definitely better results.